From the horrors of the Second World War, an idea was born. The idea was to define the rights of civilians, even during times of war, and then protect those rights. The Fourth Geneva Convention was adopted in 1949 and then implemented the following year. Its promise was clear. No murder, no torture, no sexual violence, no hostage-taking, no mass forcible transfers, access to health care and food, hospitals should be spared, detention regulated, civilians in occupied territories protected. There was also non-discrimination. Everyone gets equal protection. And the ICRC, the International Committee of the Red Cross, and humanitarian organizations are allowed to work in conflict areas. Well, today, the world is witnessing 130 armed conflicts. Israel's genocide in Gaza, a civil war in Sudan, which we just discussed, and a war between Russia and Ukraine, most notably, are testing our duty to protect the rights of civilians trapped in these conflicts. In Gaza, hospitals have been routinely attacked and destroyed. Palestinians are forcibly displaced, not just once, multiple times. Even since the ceasefire that was signed in October, access to medicine, food, and shelter has been severely restricted. The thousands of Palestinians from Gaza and the occupied West Bank are locked in Israeli jails, and the Red Cross has been barred from visiting them since October 2023. In fact, there are reports and evidence of torture, forced starvation, and sexual violence against Palestinian detainees, many of them locked up without charge, without access to lawyers, without even family visits. And in Sudan, there are alarming reports of sexual violence, of mass killings, and of summary executions by the paramilitary rapid support forces, particularly in areas like El Fasher in the Darfur region. Rescue workers, healthcare, and aid workers have all been attacked, and their work has been restricted. The Fourth Geneva Convention was meant to shield civilians from the worst effects of war, but today, those guardrails are being shattered over and over again. Now, Pierre Krahenbuhl is the Director General of the International Committee of the Red Cross, and he told Al Jazeera earlier that conditions in Gaza are still very treacherous for his teams.
We feel that we have been dealing with very permissive interpretations of international humanitarian law. Some parties will justify everything that they do through the lens of this is fully compatible with international humanitarian law, when in fact, on the ground, civilians are being targeted, hospitals are being attacked, and we see the most grievous violations of international humanitarian law. This requires a remobilization for all of us to say, if this is what war is, if what we have seen in Gaza over the last 2 years is what we are prepared to tolerate, then indeed our entire humanity is at stake. It is essential that the ceasefire holds, because we have witnessed on the ground, my colleagues who have worked in Gaza tirelessly over the last 2 years have witnessed every day very extreme circumstances in human terms. And so the ICRC's role in this first phase after the establishment of the ceasefire was to ensure that the hostages who were alive could return and be brought back to their families, and Palestinian prisoners who were released could also be returned to their relatives, that also the remains of the deceased hostages and Palestinians could return. We have been carrying out this activity now. The complexity of it is, of course, first of all, the circumstances on the ground. There is the result of a very violent conflict, devastation all around. The careful attention given to retrieving the bodies of the deceased and bringing them back respectively is a painstaking effort, and we were determined to carry this out as our modest contribution to ensuring that the ceasefire can hold and that the families in particular would obtain some relief through these activities. We require the cooperation of the parties, and that concerns both Israel and Hamas for the completion of this phase of return of the remains of the deceased. So we're in the final stages of this operation. What is now crucial as we move into the next phase is also, of course, an increase of assistance going into Gaza. This is very important. Currently, we still do not have enough humanitarian aid reaching the Gaza Strip through different organizations. We need also a focus on the rehabilitation of health facilities, the water systems need to be reestablished, and of course at one point we will have to consider the very delicate reality that for thousands of families in the Gaza Strip there's uncertainty about something that has happened to a loved one whose bodies may still be under the rubble. And so we can imagine the environment as being, from a human perspective, still extremely traumatic for many, and this will require the attention of everyone. So of course we had the phase of the 2 years that were very difficult, very dangerous from a security point of view. We saw humanitarian organizations, our colleagues in the Palestinian Red Crescent, but also us, the ICRC and others, who lost colleagues. Colleagues were injured during this phase, so it's true that access was extremely difficult. Now in this phase it has improved. We are able to move more freely. It is not without risks, but it is more open. The access has improved. We have to continue to develop that access. And what we want to insist on especially is that aid should reach people. It should no longer be that civilians have to move several times through different parts of Gaza to obtain the aid. This is now a question of fundamental dignity for the persons who have lived such traumatic events, who have been displaced so many times. Now it is time to ensure that aid can reach people and not the other way around. So the ICRC itself established a field hospital in the area of Rafah during the war that provided consultations for over 150,000 people, thousands of surgical interventions that were life-saving. Children were born in this hospital, and sometimes this was carried out in the midst of extremely intense hostilities all around, with shrapnel and stray bullets flying through the hospital, sometimes injuring patients. So now it's a different phase, and thankfully there are fewer patients arriving in the hospital itself, so we can now concentrate on supporting medical installations, first of all working with our colleagues in the Palestinian Red Crescent Society, but also working with National Red Cross and also now Red Crescent through the Qatari Red Crescent Society, for example, in strengthening the medical response in the Gaza Strip and reaching more facilities to be able to reinsure access to essential services such as healthcare to a much wider population in the Gaza Strip. There is indeed a responsibility to give the ICRC access to persons detained. This is foreseen under the Geneva Conventions. And we had, for decades actually, visited Palestinian detainees in Israeli places of detention, and also been able to ensure, for example, family visits, communications. And the fact that this has been impossible for the last 2 years is a grave concern to the ICRC, because our role is precisely through the visits to ensure that the treatment of detainees and the conditions of detention are safeguarded in dignified and respectful ways, and that families have possibilities to communicate. The fact that this is not the case right now is indeed a serious concern for us, something we keep communicating actively with the Israeli authorities on.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.